All
And
right,
I
well, good
understand there's,
afternoon. Good afternoon, everyone. We will go ahead and get started. So, welcome to today's Age Well series presentation, prescriptions, supplements, and everything in between. We are going to be talking about understanding the link between medications and preventing falls as we age. So, my name is Jill Rankin. I'm the executive director for the Wisconsin Institute for Healthy Aging. We are a nonprofit organization that serves the state of Wisconsin and beyond. And our mission is to improve the health and well-being of all of us as we age here in the state of Wisconsin. We do this by disseminating evidence-based health promotion programs. We partner with over 100 different organizations in the state of Wisconsin that implement programs that increase health and well-being. And we also engage in larger public health and collaborative initiatives throughout the state, such as falls prevention and social connection. So we invite you to take a look at our website if you haven't already and sign up for our Age Well newsletter. Lots of really great health and wellness topics coming out through those mechanisms. I also want to especially acknowledge one of the initiatives that we work on is largely fall prevention, as it is an important topic as we age. And we also convene here at WEHA the statewide falls prevention collaborative, a falls prevention coalition called Falls Free Wisconsin. So if you haven't heard of Falls Free Wisconsin, you can also feel free to check out that website. It is fallsfreewi.org. And you can also link to the Falls website through our general WEHA site as well. So thank you, Suzanne, for putting that in the chat, fallsfreewi.org. There's a lot of resources on there. Anything and everything that you want to know about when it comes to increasing your falls resiliency, getting stronger, and preventing falls, all on there. Partly, we have some medication management information as well as lots of other different types of fall prevention strategies, but we are going to highlight medication management today, which is going to be presented by Nancy. So I will go ahead and turn it over to Nancy, but actually before I do that, a real quick housekeeping. So if you could mute your lines while Nancy is presenting, that would be great. We will go ahead and answer questions. We have at least 15 minutes at the end of the presentation scheduled for question and answers. So feel free to type your question into the chat function if you'd like to while she's talking. Otherwise, we'll be able to come off of mute and ask Nancy some questions as we go through the presentation towards the end. So thank you very much for joining us today, and I'll turn it over to Nancy. Thank you for being here with us.
Thank you, Jill. I'm excited to be joining you today. I'm a big supporter of WEHA and Falls Free Wisconsin. I am a pharmacist by trade. And on top of, I am a hospital pharmacist. I work at Ascension Elmbrook Hospital in Brookfield. I am also a board certified geriatric pharmacist. So I'm very interested in everything having to do with aging, but most importantly, I'm interested in falls prevention. And I'm just as proud to say that I am a stepping on facilitator. If any of you are not familiar with it, it's a wonderful falls prevention program. It meets for 7 weeks, and one of the weeks we do talk about medications and falls, which I'm going to talk about with you today. I'm going to pull up my screen. Okay. As we all know, prescription supplements and everything in between, which is a pretty tall order, and I have a lot of information to present today about falls and medications and supplements, things like that. And as Joe mentioned, if you want to type questions into the chat or if you just want to jot them down while I'm speaking, we will have a opportunity for questions after we're done speaking. Okay, why are we talking about falls today? I'm going to spend just a few minutes talking about falls in general. Annually, 25% of people over the age of 65 fall and report it to their doctor. Pay attention to that part of that sentence. 37% over the age of 85 fall and report it to their doctor. But it is estimated that half of falls are never reported to a healthcare provider, and there's a multitude of reasons for that, which we're not going to delve in today. Falling once doubles your chance of falling again, and falls are the number one cause of accidental death in older adults. When you think of all the statistics we hear about aging and all the things that can happen, we think about heart disease and cancer and Alzheimer's and stroke and things like that, all causing death. Um, I don't think it really comes up to the top of anybody's minds that falls are that dangerous, but they are. And there are many falls risk factors that I just briefly want to go over with you. It's not all about the medication. There's a lot of different things that can increase our risk of falling as we age, and just you might want to check these in the back of your mind and think about what you do at home. As mentioned on the previous slide, a previous fall is a huge risk factor for having another fall. It can increase your risk of by up to 50%. And that kind of plays into maybe we should tell people when we fall. You don't have to run off to your doctor, but maybe explore ways of decreasing your risk of falls. Lack of strength and lack of balance is one of the leading causes of falls. We all know as we age, unless we really put a lot of concerted effort into it, we are going to lose some of our muscle and some of our strength. And if we become less mobile, we're going to lose some of our balance perhaps too. Home and environmental safety hazards. I want everybody to think about throw rugs in their home. Throw rugs can be very hazardous if they don't have a sticky backing to them. Poor lighting, that's also another home and environmental hazard. If we don't have our stairs lit well, if we don't have hand railing on our stairs, if we get up in the middle of the night to go to the bathroom and don't have a night light, that's just increasing our risk that we might have a fall. Vision and hearing changes. These are things, as we all know, as we age, happen pretty insidiously, and we might not realize how poor our vision has gotten or how much our hearing has changed. And it's only been recently that experts have started to really explore the effect of hearing changes on our risk of falls. And there is a significant increase in our risk of falls with hearing changes. And with vision, if we're not keeping our glasses clean, if we are not used to using our bifocals, things like that, that can increase our risk. Problems with feet and improper footwear. These can be caused by a multitude of issues, anything from bunions to diabetic problems with our feet. If we can't, if we're having problems with our feet, it's going to lead to the probability that we might trip and fall. Certain medical conditions, and I'll get to that a little bit later in a few slides. Being on four or more medications today, being on four or more medications, and I'm hoping that's why a lot of us are tuning in today to learn more about that. And being in a hurry, it's people don't think about this with the fall, but if any of you have taken stepping on, you'll know in the very first class, we go around the room, everybody has to tell me why they're there. Have you had a fall? Are you worried about a fall? Tell me your fall story. It is astounding the number of falls that are caused by people being in a hurry and not paying attention to what they're doing. So even if you don't have any of the above risk factors, we're always all in a hurry every day, and it is a risk factor. 42% of older adults take 5 or more prescription medicines every day. And remember the previous slide, one of the risk factors is taking 4 or more days. So this affects a whole lot of people. Why do medication-related falls happen more in the older population? Um, as we just said, we're taking more meds. A lot of people take 4 more meds a day. The body does not eliminate meds as efficiently as it used to when we were younger, just as our vision changes as we get older, other things in our body change too, and we can't clear medication out of our systems as efficiently. there's more drug interactions. Obviously, the more drugs you take, the more chance you're going to have that they're going to interact with each other. And if you're on two medications that may cause dizziness or drowsiness, um, that's that's more than going to double your risk of having unsteadiness from that. More medical conditions adding to falls risks. And 3 out of 4 older adults take at least one medication commonly linked to falls. So not only are we taking more medications, we're taking more medications that are putting us at higher risk to start out with. Okay, one thing I want to mention because it's very pertinent as we age is blood thinners. Now, I put this slide up here close to the start of my talk because I don't want anybody to think about, oh, I'm on a blood thinner, it's going to increase my risk of having a fall. It is not going to. Blood thinners do not increase your risk of having a fall, but the consequences of the fall may be higher if you are on a blood thinner. Um, Falls can lead to all sorts of consequences. Oftentimes, and hopefully, they just may lead to a little bit of embarrassment and a few bruises, but a fall can be devastating. I'm sure we all know somebody or have heard stories about people who have fallen, broken their hips, gone to have surgery, go to a nursing home and never come home again. And that is a very devastating outcome of a fall. But even more devastating, if you're on a blood thinner, it really increases the risk. If you fall and hit your head, it very much increases the risk you're going to have a head bleed. And that can be even far more devastating than breaking a hip. Um, Most common blood thinners are warfarin, Eliquis, Xarelto, and Pradaxa. And like I said at the beginning of the slide, a lot of people are on these are commonly used for people with AFib, and the incidence of AFib does rise as we age, or people might be on them because they have a history of blood clots in their legs or a deep vein thrombosis, a DVT you may have heard of, or a PE, a pulmonary embolism. So if people have a history of getting those, it's very likely that they'll be put on a blood thinner for that. And just keep in mind that they do not increase the risk, but if you are on a blood thinner and you have a fall and you're not sure, or you are sure that you hit your head, you do need to go to the emergency room to have it checked out to make sure you don't have a head bleed. Okay, this is all the pharmacology and medicine I'm going to teach you today. But it will really explain why we really have to be careful with medications. As I kind of alluded to before, as we age, the body's ability to break down and eliminate drugs is decreased as we age. That is because, like our eyesight, some of our other organs don't function as well as we age, mainly our liver and our kidneys. And the liver is how the body eliminates a lot of the drugs, even the GI tract. Our elimination can become slower as we age. Some things are flushed out through the GI tract. So, drugs that are going to stick around in your body or have the potential to stick around in your body longer the older we get. And we'll also discuss this a little bit, a few slides ahead. Oftentimes you're put on medications when you may be younger and they're working great. And you go and you see the doctor every year and it's like, oh, that blood pressure medication or that diabetes medication is working great. And they don't really do a good assessment. It could be that you could get by with the lower dose of it because if 20 milligrams worked really well, it could be that 10 milligrams might work now because the body isn't being cleared from the body as efficiently. As we age, people just tend to be on more medications, and side effects can be potentiated. Like I said before, 1 plus 1 might not equal 2 when it comes to side effects. That might equal 3. Maybe you get a little bit drowsy from one medication and a little bit dizzy from another medication. You could be if you take the two of them at the same time, they can be more than additive, and you can become really drowsy or dizzy more than you would expect just from taking one or the other of them. If we're taking more medications, as we know we typically do as we age, you have an increased chance of taking medications incorrectly just because if you have a pill box full of things, or if you have a bathroom counter just, with a whole lot of bottles of medication, um, there's just the odds are you could be taking something incorrectly. And we will be addressing that. We have an occupational therapist actually speaking after me who's going to talk about some really good methods for trying to assure that we take our medications correctly. And we just have a greater chance of being on a drug that may cause a fall. Okay, as promised, I'm going to talk just a little bit about medical conditions themselves that can increase falls risk. And this slide is by no means all inclusive, and I'm not going to get into this at all. It's more just so you can see there's a lot of things that can go wrong with our body that we might not associate with having a fall that can cause a fall. So this is more just for, just to get you thinking, there's a lot of things that are going on with us. Arthritis is pretty self-explanatory. We can't get around as well as we used to when it hurts, and we might be compensating with the way we get around. Parkinson's disease causes shuffling and unsteadiness just by virtue of the disease. Diabetes and neuropathies, you might not be feeling your feet as well. Stroke can cause a whole lot of symptoms that make it not easy to get around. Cardiovascular diseases they can lead to a lot of shortness of breath and weakness. Vision and hearing changes I mentioned before. Cognitive impairment in and of itself can actually lead to a higher risk of falls for a variety of reasons. Foot problems, incontinence and nighttime urgency, and you might think to yourself, how does having to pee a lot increase my risk of falls? Well, as we age and we might have incontinence or even more so the urgency, you could be just relaxing in a chair in your living room. And if you have to get up in a hurry to get to the bathroom, it's where that hurrying part can become a problem. Or if you have to get up multiple times during the night to use a bathroom, that is very much a falls risk in and of because it's dark, you might be half awake. That can certainly be a risk. Poor nutrition and hydration, you're weaker, your body isn't well nourished. And then if you do have a fall, it can lead to a harder time recovering from a fall as well. Taking four more medications, okay, I've said that a few times, but if you get one takeaway message from this talk, um, that would be it. And vertigo or dizziness, which is understandable that it can lead to falls risk. One medical condition I'd like to go over just a little bit more in detail is postural hypotension or orthostatic hypotension. I can't see a show of hands by the crowd, but I know many people when you stand up quickly or when you get up out of bed too quickly, you may feel dizzy. I know a lot of people who have had this problem, especially in the mornings. If they stand up too quickly, they're so dizzy that they fall back into bed. This is postural hypotension. What it is, as we age, our blood vessels can't accommodate changes from lying to sitting to standing as well. So our blood pressure isn't going up to support us as we stand up. So your blood pressure is dropping, you're not getting enough blood flow to your brain, and it can lead to a lot of dizziness and falls. Staying hydrated is one way to help combat this. Sometimes this happens, and it could be, I know some people have it very severely, and that you need to see a cardiologist or an endocrinologist if that happens. There's medications that you can be put on for it, but if you're starting a new blood pressure medication or they're changing your dose, it's important to note this and get back to your provider if this is something that's happening to you. One piece of advice we always like to give people when they're started on a new blood pressure medication or changing the dose, as I mentioned, when you get up in the morning, dangle your feet over the side of the bed for maybe up to 30 seconds and then hang on to your nightstand and stand up from there. That's one way to combat it. Another thing, if you're sitting in your living room or your kitchen table relaxing, and if the doorbell rings, don't jump up quick to see who it is. Or in the olden days, we always used to say if your phone rang, you'd want to get up to get it. But a lot of times, I know people don't have landlines anymore. With the use of cell phones, people don't seem to be rushing as much to get their phones as they used to. But just anytime you're sitting, be aware of this and rise slowly. I am going to briefly go over, there are 7 categories of medications that have more of an effect on falls than other ones, but I'll give you a few names of each of these, but it's not my point in this talk to really, this isn't a pharmacology course. I don't want to really spend a lot of time on the particular drugs, but just the classes of medications that we really need to be aware of that may increase our risk of falls. The first are opioids or narcotic pain medications. And then I have some subsequent slides that I will give examples of a couple of each of these. But anti-anxiety medications and antipsychotics, prescription and over-the-counter sleep aids. So, way to pick up on that. It's not always all prescription medications that can be problems. Over-the-counter medications you need to be aware of some of them as well. Muscle relaxants, some over-the-counter allergy medications, some medications for bladder control, and we know that bladder problems and incontinence and urgency are a problem already, so it makes it worse that some medications can add to the problem as well. And one that people don't always think of is blood pressure and heart medications, but I'll get into those a little bit more. Opioid or narcotic pain medications. Common ones are oxycodone, which would be OxyContin or Percocet, hydrocodone, which is Vicodin, and tramadol, which is Ultram. And this is pretty obvious. If you ever get a prescription for them, they're going to have a big red warning sticker on this. It says, don't operate heavy machinery with these. They will cause, especially if you're what we call opioid naive, if your body isn't used to having them in your system, one of the main side effects is drowsiness or dizziness. And oftentimes, or not oftentimes, but it can be, let's say you've had a fall and you've sprained an ankle or hurt your wrist or something, and it hurts pretty bad. And if the physician does give you something for it, a Vicodin prescription, first of all, try to minimize the use of it. It will, if your body's not used to it and you do take it, chances are it is going to make you dizzy or drowsy. Medications used for depression or mood, and I only listed 2 of them here, but there are a whole lot of medications in this category. 2 of them that may be more commonly known are Paxil and Elavil, but the list is very extensive. And the good news about these medications is the worst of the dizziness or drowsiness usually occurs when you first start taking them. Except for Elavil, it's an older medication. We don't see it used much for depression anymore. We actually see it used to help people with sleep because it does cause that much drowsiness. Anti-anxiety medications, Valium, Xanax, and Ativan are the 3 that we probably see the most, and it's pretty self-evident. They are going to relax you, and not just your brain, but they'll relax your body as well. Prescription and over-the-counter sleep aids. Ambien and Lunesta are the 2 most popular prescription ones, but there's also ones we can get over the counter, such as Unisum, and then diphenhydramine or Benadryl is in a lot of products. And I'm dedicating actually a couple slides later on to sleep aids and sleeping and the danger of these drugs when it comes from a falls prevention standpoint, and maybe some other tips to try to not to have to take them. Muscle relaxants, kind of like with the anti-anxiety drugs that are just very relaxing. just by virtue of the fact that they're muscle relaxants, they're going to lead you to be not as steady on your feet. Robaxin and Flexerol are two of the common brand names of ones that we see. And once again, if you are put on these, hopefully your physician or your healthcare provider just puts you on them for a very short period of time. Medications for bladder control. Ditropan was the only medication that was available for a really long time for urinary problems, for incontinence and urgency. Fortunately, there are a lot of newer medications out on the market that are as effective, but don't have the drowsiness or the dizziness side effect. Over-the-counter allergy and motion sickness medication. I mentioned diphenhydramine on the previous slide. Diphenhydramine is used for a lot of things, and diphenhydramine can be a really good drug. It is what they call a first generation antihistamine. There's newer ones out there now, like Claritin and Zyrtec, that don't cause the sedation that diphenhydramine does. And I really sometimes I get carried away with bad mouthing diphenhydramine or Benadryl, but I want you to keep in mind if you are having an allergic reaction, by all means take Benadryl. It's going to work very effectively for it, probably the best of any of the antihistamines. But if you need something to help you sleep, there are safer alternatives. Antipsychotics or mood stabilizing drugs, haloperidol, which is Haldol, more commonly known as Risperdal and Seroquel, are three of the most commonly used ones. The as with the mood stabilizing or the antidepressants, the list of these is quite long. And once again, once your body gets used to these, typically the side effects aren't as pronounced. Blood pressure and heart medications. These are an interesting bunch, and at first glance, you would think, oh, we need to worry about falls risk because we have to worry about them lowering our blood pressure or lowering our blood pressure too much or too quickly, which is true. But there is another mechanism involved that science hasn't totally figured out yet that even if they aren't lowering your blood pressure by large amounts, they can still cause some dizziness, especially when you start taking them. And another one that I want to point out on this list is furosemide or Lasix. It is a water pill. It will lower your blood pressure and it will make you have to go to the bathroom very urgently, especially if your body isn't accustomed to it. So once again, it's all that trying not to be in a hurry. And as a pharmacist, also some of these medications, like sometimes people, especially people with pretty severe heart failure, are put on furosemide twice a day. I always tell people it does not need to be taken every 12 hours apart. I always tell people take it at 8 in the morning and 4 in the afternoon. It will work just as effectively, but then it will hopefully that will help to decrease any nighttime urgency you may have for it. Okay, so that is a pretty extensive list of medications, and you're like, well, I don't know what these drugs are. I'm not going to remember to ask my doctor how do I do this? This is what I really want to bring out of this talk is you don't need to remember what the medications are. It's nice to have a list and nice to see, oh, is this putting me more at a risk? But the way you know if these medications are going to be a problem, we're going to look for the side effects of the medications. And here's a listing of some things I want you to think about, either from medications you're already taking or medications you might be started on, because these are the side effects that are going to increase your risk of a fall. Blurry vision. We already talked about how vision changes can increase our risk of fall. Daytime fatigue. That's pretty self-explanatory. If you're tired and you're laying on the couch and you're not feeling steady on your feet. Drowsiness, day or night. Fainting or passing out. Lightheadedness. Loss of balance. Muscle weakness. Slowed reaction time or trouble concentrating or problem solving. This sounds like a lot like the list that we looked at earlier of things that increase your risk of falls. So any of these medication or any of these side effects you feel might be increasing your risk of a fall. And anytime I talked about the big red sticker may cause drowsiness when operating a car or dangerous machinery, if you ever see that, instead of driving with caution, I want you to automatically think walk with caution. This is where the pharmacist part of me really is going to get into this. We're going to spend a few slides now and some time talking about why it's important to know what you're taking and how to talk to your healthcare provider or pharmacist about this. I really, as a pharmacist and a healthy aging advocate, everything I do, I want to help people feel empowered how do you empower yourself to stay safe? Healthcare is really complicated and it's getting more complicated every year. That's why, especially going forward, I like to emphasize to people you really need to take ownership of a lot of this. One way is to keep an up-to-date list of everything you take, including prescription meds, over-the-counter meds, and supplements. And Mike, our occupational therapist, who's going to speak after me, is going to go into this in more detail. So I'm not going to spend a lot of time because he's got some really good information and some tips on this. Keep in mind, there's many ways to keep a list on paper, on your phone, on your computer. Often, every time we go to see a doctor or we get discharged from the hospital, they give us an after visit summary. And this should have every medication you're on, and it's a good time to look at this. And if they're not on there, it's a really good time to talk to your healthcare provider. Ideally, use one pharmacy that will help. That way, the pharmacist there knows everything you're on. This is just an example of what a typical paper medication list looks like. Like I said, Mike has some other examples of this and some really good advice for filling one out. Every time I give this talk, I get somebody saying that why do I need to keep this? All this information is in the computer. As a healthcare provider, it pains me to say this, especially a healthcare provider that's worked in a hospital for a whole lot of years. It is not necessarily all in the computer. A lot of the healthcare systems, especially here in the Milwaukee area, use Epic as their software system. So some of the information does cross, but it's always the old saying, garbage in, garbage out. That's why I'm giving you the challenge of making sure that the information that's in the computer is up to date and accurate. And different healthcare systems use different software. Sometimes we have patients that are visiting from out of state and unfortunately have to come into the hospital for some reason. And if they can't tell us, we don't have any idea what medications they're on. So I was saying that it may be especially true when you are traveling to have this information, up-to-date information with you. And if you see multiple providers, and most people do, you might see a cardiologist for your heart and an endocrinologist for your diabetes. Their offices and their systems might not, oftentimes they do, but they might not always communicate with your main physician's system. And then also, nobody may know what supplements or over-the-counter products you're taking. How to use your medication list. Once again, Mike will talk about this, but list everything you take and your provider's name and your emergency contact and take it with you everywhere, especially when you travel. Keep it updated. Review this list with your healthcare provider at least once a year. If you're over 65 and you have your annual Medicare visits, perfect time to do this. One thing that some people don't think of, keep a list of side effects, especially when starting a new medication or changing doses of a medication. This can really pinpoint, like I said before, maybe the medications that we're taking, they could not, that might be that you're not on the appropriate dose anymore. Um, and once my disclaimer, do not stop taking any medications without first speaking to your provider. What to ask when you go see your provider? What is this medication for? I know everybody in healthcare is really rushed and I shudder thinking about this, but I'm sure there are still prescribers out there that don't take the time to really explain why they're putting you on a medication. And secondly, does it replace any medication I'm already on? They could be checking your blood pressure, seeing it's not really under control, so they write a prescription for another blood pressure medication. Do they want you to stop taking the other one, or is this in addition to? Sometimes it's not. And when you're in a doctor's office, you're absorbing a lot of information. So you might want to make a list of these questions and make sure you ask them. What does this medication do? What results can I expect? And when should I take this medication for how long? Should it be with or without food? If it's an antibiotic, is it for 3 days or 7 days, 10 days? If it's an antibiotic, it's important to know how long you should take it and then take it for that entire time. What are possible side effects of this medication? And what should I do if they occur? If it makes me feel dizzy or drowsy, should I stop taking it after I contact you? Or can I expect that to go away in a week or two? Might it increase my risk of a fall? And will this medication interact with other medications or supplements? And do I need regular checkups or tests? A lot of new medications that have come out, you do need to have your blood work checked at maybe 3 months or 6 months or whatever. And that is a lot of questions to ask, but they're all really important questions. And you might feel overwhelmed. You might feel like your provider is overwhelmed. One solution to this is to schedule a brown bag visit. And this might be helpful if you feel your provider does not have the time to adequately discuss your medications and concerns. And it is literally, like it says, you literally put everything in a bag, your prescriptions, your over the counter, your supplements, and you take it in. And these are typically there are some clinics that have other providers that provide this services, but typically this is a pharmacist service. And then the pharmacist will review this and send a letter to your provider if they find anything that appears to be worrisome. It may be covered under your Medicare coverage, and it is valuable for many things besides falls risk. You might be on duplicates of medications that you don't need to be on. Maybe you were started on something long in the past and are put on an additional medication you might not be on. The unfortunate thing about brown bag visits, they are not easily available in all areas, and you might need to call around. I know in the Milwaukee area, there's a chain of pharmacies called Hyatt Pharmacies. I believe they do offer this service. And just one other thing I want to mention about having your information up to date. This is a neat little program. As you can see, it's called File of Life. And this is designed to be put on the outside of your refrigerator. Some people don't feel comfortable doing that, but basically what it is, it's as you can see from the picture on the right, you list all your medications and your doctor and your emergency contact. This is in case you have a medical emergency in your home and first responders have to come. They know where your medical information is. Um, because if you're not able to tell them if and the hospital you go to doesn't have your records on file, this is really important, especially things like allergies, things like that. So these are usually easily available from like fire departments, things like that, or you can look them up online. You don't need to have the official File of Life little red folder. You can make up your own and leave it wherever you like. If you don't leave it on your fridge, I recommend leaving a note on your fridge if a first responder comes in saying, please find my medical information here in the house. Like I said, some people don't feel comfortable with having this information on display for everybody that comes into this kitchen, but just the point of it being that it's important to have this information available. I do want to address alcohol and illicit drugs and the risk of falls. We live in Wisconsin. I have lived in Wisconsin my entire life. It is a social and a cultural given that a lot of people enjoy cocktails. And I'm not a teetotaler and I'm certainly not judgmental about this, but I just want to bring up the fact that as I talked about with drugs, if you are taking two drugs that can both make you dizzy or drowsy, the effects are going to be additive. And it's the same with adding alcohol or illicit drugs to any of these two. Just really be aware of what you're doing and how they make you feel. A lot of people don't think about this or don't acknowledge this, but it definitely is a risk. Um, And this isn't just for aging. It can happen at any age, and these effects may be more pronounced or dangerous in older adults, and they may interact. Okay, I'm running a little short on time, so I'm going to speed it up a little bit here. But like I said, we do have time for questions afterwards, so feel free to jot questions down if I skip over things or if I go too fast on something. But I really want to talk about why to use caution with sleep medications. As we age, well, even at any age, sleep medications, either over the counter or prescription, can cause daytime hangover effects. We still may feel groggy in the morning, falls, unsteadiness, and confusion. And some of the prescription ones may be potentially addictive. So, my advice, use for the shortest time possible, especially the prescription ones. Most of the over-the-counter products that we see for sleep are like Tylenol PM or Advil PM. The PM means it has diphenhydramine in it. What I suggest sometimes when we're having problems sleeping, it's because we might have some little aches and pains that are bothering us. Try taking just ibuprofen or Tylenol first and seeing if that relaxes you enough and gets rid of the pain enough for you to fall asleep before you switch to a product that has the diphenhydramine in it. One product that I will, as a professional, recommend that you never ever take is ZzzQuil, because ZzzQuil is just alcohol and diphenhydramine. It's unnecessarily sleep and falls producing. Okay. If you do feel you need to take something to help you sleep, I recommend melatonin. It does not work for everybody, but some people it works really well for. And if you haven't taken it before and you're just starting, start with a small dose, like a 2 or 3 milligram dose. You're going to see if you go to Walgreens and look for them, you're going to see everything from 2 milligrams up to 20 milligrams. This is a medication because it mimics your natural sleep wake cycles. They actually find it's more effective if you start with the lower dose. Tips for better sleep without necessarily using medications. No blue screens, so phones, computers, things like that, an hour prior to sleep. Try to limit napping during the day. And if you do, try to make them cat naps, like little 20 to 30-minute naps. Try to get regular exercise daily, preferably out of doors, unless you live in Wisconsin in the winter. But earplugs, get checked for sleep apnea. No large meals, caffeine, nicotine, or alcohol prior to bed. Some people find that doing meditation or there's apps on phones that will help calm you. Or white noise, a noise machine, or have a set sleep routine. Try to go to bed and wake up at the same time every day. Now I want to kind of change gears a little bit and talk about, since we're talking about supplements, or talk about calcium and vitamin D. Calcium is essential for bone health. Our bones are made with calcium, and vitamin D helps the body absorb the calcium. As we're probably all aware of, the incidence of osteoporosis increases as we age. We want to keep our bones strong because if we do have a fall, the stronger our bones are, hopefully decrease the risk of having a fracture. So how much do I need? On the left, I have a chart from the National Osteoporosis Foundation with age, different ages and different amounts. But to make it easier to remember, everybody listening to this talk, um, try to strive for calcium 1,200 milligrams a day from all sources, meaning dietary and supplements. And vitamin D, we should get between 800 and 1,000 units, or 20 to 25 micrograms, are usually labeled in both units and micrograms daily. Sources of calcium, foods. Dairy products. We all have heard forever, drink your milk contains calcium. It does. Milk, cottage cheese, cheese, yogurt, all those, they do contain calcium. And if you look on the side of the container, you can see how much. Leafy green vegetables and fortified foods. If you're lactose intolerant or you just don't care for milk, then you can choose to take a supplement. The two most common supplements are calcium citrate and calcium carbonate. And some of them you can buy with the vitamin D in them already. It's important to look at the serving size when looking at the label. You might find a product and it looks like, oh, this will give me 1,000 milligrams of calcium, but you might need to take 3 tablets a day. So if you're looking and you're trying to find what the best value is and how, the most efficient way to get it in, my personal favorite is extra strength Tums. You can get it very reasonably at Costco, and if you have any stomach upset, it helps with that. And it's really an efficient way to get your calcium in. Just a word between the difference between the calcium and the citrate and the calcium carbonate. You're going to get calcium from both of them. The calcium citrate is usually a little bit more expensive. The calcium carbonate works just as well. In an ideal world, you would take calcium carbonate with food for a little bit better absorption, but you're going to get enough from taking it that the difference in absorption really won't matter. Sources of vitamin D. As we all know, our body can manufacture vitamin D from sunlight. I usually don't recommend this as a reliable source of vitamin D, though, because A, we don't want to expose our skin to too much sun, even in the few months we can. And we just can't measure how much we're getting. So, fatty fish is really one of the best sources of it. Cod liver oil is the absolute best source, but I never recommend that to people. Egg yolks have some vitamin D in it. Fortified foods. As you can see from the list, it's not as easy to get vitamin D from our diet. So, talking about vitamin D supplementation, there are two different forms of vitamin D you can buy. Vitamin D3, which is cholecalciferol, that is by far the most common. And if you're going to go to the store and look to buy some, that is what you should look for. And remember, the recommended dose is 800 to 1,000 units a day. Vitamin D2, if you do find this is ergocalciferol, it comes in much higher doses, like 50,000 units instead of the 1,000. And this is intended for people with certain medical conditions. So without the advice of a physician, no one should ever take vitamin D2 or ergocalciferol. Um, and if you feel like you need vitamin D, you might want to have your blood levels checked to see if you even need to supplement. Back in the thinking on this has changed recently. I'd say over the last 5 years, I used to automatically just tell people, "Oh, take a supplement." But now what they're doing, the blood test for vitamin D is just a very simple blood test. And they'll look to see if you have a normal level, which if you're curious is between 20 and 50. And if it's within that range, what I do, I tell people not even to bother taking it. Your body doesn't need it. Your body has enough. And as far as maximum limits, do not take more than 4,000 units a day. It can cause nausea and vomiting and muscle weakness and even irregular heartbeat. Okay, my final words of advice on falls prevention, and I apologize, that was a lot of information really quickly, but like I said, I'll stick around for questions as long as it takes. Slow down and take your time. When you're going anywhere, be aware of your environment, especially in poor weather or in lower lighting situations. And when you're standing up, be alert for postural hypotension. Don't be in a hurry and get up slowly. And I'm sure Suzanne can put in the chat, the CDC has a lot of good information on it about this. If you want to learn more about medication lists, here's a link that Suzanne can share. And then always feel free to go to Falls Free Wisconsin. As Jill talked about, along with just the WeHa website, Falls Free Wisconsin has a lot of really good information on it. Thank you for your attention, and I'm going to turn it over to Mike, our physical therapist, to pick up where I left off.
All right. Hello, everyone. My name is Mike McKinnis. I'm an occupational therapist. I'm going to share my slides here with you. All right. Okay. So now everyone can see that. So Nancy shared a bunch of amazing information with us. And so here's just a slide to kind of review real quick with you. So just some questions. I'm going to have you look at those for 1 second. From a time standpoint, we'll move on from this rather quickly, but just as a review, these are things that Nancy has covered thus far, and then I will review again in the following slides. So, all right. So who else knows about your medication? What medication are you taking? What does your medication look like? We'll talk more about that, shape, color, size. When do you take your medication, and why are you taking your medication? So what I'm going to review is your, not sure my slide is not advancing here. Here we go. Okay. What I'm going to share with you guys is on medication routines specifically. Okay. So when you think about your day, you know that you have to take medication. So our brain really looks for associations and patterns, right? So what are those things that you're doing naturally in the morning? So in the morning when you take your medications, are you eating breakfast? Are you watching a show like Good Morning America? I know in the chat, many of you were talking about your dog and, walking your dog and making sure you didn't trip over your dog. So that would be an example. So in the morning when you take your dog, can you build a routine that says when I take my dog out, I take this medication? So we're just looking to help build routines that those things that you're naturally doing every day anyway, associate those with your medications. So in the morning, if it's breakfast, if it's brushing your teeth, sometimes brushing your teeth is great because you're right in front of your medicine cabinet and oh, I'm brushing my teeth and I can open the cabinet and take my medication. So once again, we're just looking for those things that are naturally occurring routines that we do every day and align those with the medications we're taking. Okay. More about routines, right? So we want to have, whether we do an electronic calendar, on our phone, on our computer, or a paper calendar, on that actual list, put every month, requesting refills for your monthly medication. Also, go ahead and write a note there that's that reminder to update your current medication list because it might change, right? If you've been to the doctor, if you've gone to that brown bag lunch or that brown bug event, kind of what Nancy was talking about earlier. And then finally, Nancy had also kind of talked about this. It's ideal to kind of pick one pharmacist if you can, so then you can build that relationship with them and then also have connecting with them to make sure that they know about your monthly refills. Okay. All right. So right now, as you're sitting here, where's your medication list? And do you have one? So I want you to take a second to think about that. Where's your medication list right now? Okay. And then where do you carry that list? Is that list on your phone? Is it a notebook? Is it paper? Where is that? So we want to think about that. Okay. And then this is one thing I want to kind of share specifically is the importance of sharing your medication list. So you can share it with a family member, a caregiver, close friend, because you want someone that can advocate for you, not only for your medical condition, but also for your medication. So no one wakes up in the morning and hopes that they, have a medical emergency and someone has to come to their home. So it's always nice. Who is that person that can be your advocate to help with giving and knowing about your medication? And as Nancy kind of talked about earlier, don't always just rely on your doctor's electronic record. Make sure that you have an updated list that you can always have and you can always take with you, regardless of whether you're going to the dentist or the doctor or any kind of healthcare provider. So EMTs. So when your EMT comes in, if you have an event in your home and they come in, they are going to naturally go to your refrigerator because they're looking to see if you have any medications like insulin or something like that that is kept in your refrigerator. So that's why they're going to go there. We talked about the file of life earlier. So anything like this, a file of life, you can have your medication list on your refrigerator. You can actually even jokingly have it in your refrigerator. I've seen some research around that that's saying not only just go ahead and put it in your refrigerator, or we also talked about putting a sticker. So if you don't want to have all this information just sitting right on your refrigerator, you can put a sticker on your refrigerator and say, check medication list in the drawer to the right of the refrigerator. So then you have some privacy, but at the same time, it's available where the EMT could check that out. Okay. Okay, so there are multiple medication lists. This is just one example. This is the same list that was mentioned on the last slide that Nancy gave earlier. So I want to kind of show you a couple of things here on this list. So on your list, make sure that you are adding all prescription medications, all over-the-counter medications, vitamins, supplements, herbal products. So you want to put that on. If you want to look over to the right side, so this is a 2-page form that you can find at this link. One of the things that we will also, in the green box here, where it says medications I don't use because of allergies or other problems. So we want to make sure in that to go ahead and write what are those medications that you have allergies to, because anytime you go to a doctor, that's going to really help. And maybe your allergies change over the years, and now you weren't allergic previously to penicillin, but now you are. So you want to update that. The other thing you want to do is add the description of your pill. What's the shape? What's the size? What's the color? Because this isn't only going to help you, it's going to help someone else that's helping you organize your medication. And also when your medications change, if they do, then you can update what that pill looks like. Okay. Okay. So let's talk specifically about strategies for safely taking medication. So on this far right, you're going to see a pill bottle, and this pill bottle has a much bigger labeling, right? So we can see right away that's a statin tablet. So, what are some things that help us to be able to see that small print that's really difficult to see, especially as we age? And then we have a magnifying glass, right? It's a really simple, low-tech way to see this. We advise a bunch of our patients at the clinic that I work at. Also, even my dad, who's 83, we implemented this for him multiple years ago, and that really does help him. He uses his magnifying glass all the time, not only for medications, but just other things, writing checks, other stuff that he needs to do. So that's a great idea. I do want to spend one moment talking about lighting and the importance of lighting. As we age, our eyes, as you probably noticed, when you go into a dark area and then you go into a regular area, our eyes don't adapt as well. So, very sunny conditions or very dark conditions, our eyes don't adapt as well. We have problems with contrast. We have problems with glare. Some research will say that we need something around 3 times more light as we age into our 60s than we did when we were in our 20s. So those are some ideas. So as we're thinking about reading labels and looking at our pills and organizing our pills, we want ideally LED lighting. Not only does that decrease energy, but we don't have to replace those light bulbs as often. And then we might be thinking about watts in the old school way, but like a 75 watt is the equivalent of like a 1100 lumen. And so that's a really nice task lighting. And we want that lighting a little above our head and kind of behind us. And then that will decrease glare as we're reading. So that's really important, lighting for any kind of task activity that we're doing. Also, we go to organize our pills. Once again, we have problems with contrast. So something like most pills are not black in color. So we're going to put it on like a black surface, and we're going to be able to pick out that yellow pill, that orange pill a lot easier as we're organizing our pill medication. Okay. All right. So, another big thing is, so we have our medication, we made a medication list, but are we able to open the pill bottles? So on our far right, we're seeing that same container again. The top is a much easier, it's not your child-proof pop top. It's a much bigger top that you can open with easier. We also have the blister ones, the bubble packs, things like that. Also think specifically about where do you keep your medication? I know if we have, young kids or grandkids around, we want to be careful where our medication is, but ultimately you want them in a place that's accessible. So if we're putting it in a cabinet, make sure that you can easily open that cabinet and you can reach into the cabinet where that's accessible to you. Okay. And then finally, organizing medications. So there's multiple options that are out there. Right here to our far left, we have an app. And so there are apps that are available both on Android and Apple and Google phones. Most of them have a free service. And then if you want more specific details, then you may have to pay a little service, but that's an option. This other one in the middle, the green one, this is something that started in Japan, but is often seen it used here a lot more. And so you might get all of your pills for Monday AM in a little pouch, and then you're going to put that in that pouch. And so you're just pulling that pouch out. We have the pill box that is more common that we see often here. And then another couple of electronic options for us. And if I say the name Alexa, then my Alexa in my office will actually go off. So this will be funny. But you might want to say to your Alexa. So Alexa, I want every day at 6 a.m. remind me to take my lisinopril, right? Or whatever your medication is. So that's a way and another backup that you have. Also, we have an electronic dispenser. There's multiple ones like this. So for example, this would be closed, and at 8:25, as that time says there, that it's going to open. And then depending on how fancy your dispenser is, sometimes it will actually dispense that medication out to you, or sometimes it'll pop open yet another container and you can easily pull those out as well. So there are multiple organization opportunities for you. Maybe you have one that you really like and maybe use one of these as a backup as well. All right. So it is final exam week this week at Concordia, where I teach in occupational therapy. So I thought we would fit in with a little final exam here. So I'll just kind of throw this up here, and then we can also come back to the group and answer these questions. But maybe things to think about is, what are you doing well with medication management? Does someone else know about your medications? And then finally, what is something you learned from today's session? So I'm going to stop sharing and come back to the main group.
Awesome. Thank you so much, Mike. Thank you so much, Nancy. We are a little bit over time with all of the great information shared. So I'm just going to share a few quick things to wrap up and stop the recording, but I believe Nancy and Mike might be able to stick on if there are any questions. You will get the final exam questions that Mike threw up in the survey and when you exit Zoom. So we want you to think about those. And then those of you that do complete that evaluation survey and put their email address in there will be entered to win one of our super cool AgeWell t-shirts, and the winner will be chosen by the end of this week. Stay tuned for the next webinar in our AgeWell series. That'll be coming up on February 11th. So we're taking January off, but our next one will be up in February, and we're going to be talking about hoarding and its relationship to falls. So the registration information will be sent out with the recording of this webinar. And I just wanted to thank our sponsors at UW Health for sponsoring the Falls Free Wisconsin initiative. And again, we have many great resources on our website at fallsfreewi.org, and you can always contact Falls at WI Healthy Aging as well. So with that, I'm going to stop the recording.